Hello, I'm Susanna Hopsalerin, Senior Editor with Hospitals and Health Networks magazine. I'm reporting from the CHIME CIO Forum, and I'm joined today by Marc Probst, Senior Vice President and CIO at Intermountain Healthcare, also the Chairman of the Board of CHIME. It's a pleasure to have you here with us today.
Thanks, Susanna. Nice to see you as well.
Thanks. You know, Marc, patient engagement is a big concern as we move to population health. And CHIME has an initiative on open notes and a collaboration. Could you explain what open notes are and what the purpose of the collaboration is?
Well, I think at a very high level, what open notes is, it's the ability to share the information within our electronic medical records with our patients. And they really have the standards and an approach to make that more easy and make that more standard across all the different settings and types of care that a patient might get. So we think it's important that patients have that information as CIOs, and so partnering via CHIME, who's really led this with open notes, I think is going to help educate us as a group and then help us educate our organizations as how best to use open notes and do this. So.
You have another initiative going on with the National Patient Identifier. Patient matching is a big concern for a lot of providers. Tell us about it.
Indeed it is. I mean, we've been talking about a national identifier for a long time. We as CIOs have. We as a healthcare industry. Unfortunately, the government's had reasons why we can't, or they can't. And so we as CHIME thought, well, what a great challenge this could be if we just put it out there. We were working with HeroX to do it, and could we go out and elicit someone that could come up with a great way of positively identifying 100% of the time who that person is, who that patient is, so that we can align then their medical information, the systems behind it appropriately, so that we're getting the right data all the time about a patient. We think that helps with safety, clearly. I mean, we'd understand things like allergies or other issues that a patient might have. But even from a cost perspective, we waste a lot of money as healthcare organizations in cleaning up the messes we make because we don't appropriately identify a patient.
Patient privacy and data security are at the top of the list for the hospital C-suite. What do you recommend right now that hospitals should be doing to make sure that they are secure?
Well, I mean, there's the logical things of having the right tools in place. Do you have good perimeter security? You know, are you taking care of network segmentation and things, really technical kind of things? But I think first thing is an awareness. All of our employees, all the people that work with our systems need to understand just how much risk exists out there. I think as a group of CIOs, something specific to CHIME, we need to work together. There are many of these problems I'm solving and others are solving that if we get together, we really could improve our security profile. We wouldn't all have to, as I mentioned earlier, be rebuilding the wheel over and over again, but we could benefit from the work each one of us are doing. So I really think that's going to be where the power is going to be. I also think there's solutions we can do as an industry that right now we're doing as individual fiefdoms. We're building our own moats and walls and things. That if we look at it holistically as an industry, things like a national patient ID, but there's other things, we will be able to do a better job, and we'll actually be able to get every ship to rise. Right now, you have organizations like mine that can invest a lot in IS security, and we are, but there's organizations that can't, and they still become a risk to patient privacy and security. So what can we do as an industry? What can we do together to make all these ships rise and hopefully improve our profile?
As we're going on this journey of healthcare transformation, how can the CIO really support the efforts and really lead some of the strategy?
Well, I don't know how we cannot. And we have to challenge ourselves as CIOs to be more strategic. We're not just technicians. And we have to be willing to kind of push our organizations to understand the capabilities that technology can now today bring to the new environment of healthcare that we live in. Being in brick and mortar hospitals and brick and mortar clinics, it'll always be there, but that's not where healthcare is headed. It's headed into the home. It's headed into the everyday activity of a person. It's headed into employers and what they're doing at work, and how do we keep people healthy. All of these things. And it's technology that's going to do it, whether it's a wearable, whether it's a monitor, whether it's a website or a mobile application. These are the ways we're going to do it. And so we have to be prepared to do that. We have to be prepared to have that conversation and satisfy our leadership that we know what we're trying to do and how we can help them. And if we do, we're going to be successful. And luckily, there's enough press by folks like yourself, Susanna, out there that our C-suites get it. And the leading organizations, they're going to pull the CIO into the conversation.
Thanks so much, Mark. I'm Susanna Hopsalarin with H&HN.